All right, here we are. So I brought you some blankets, and I know you said you were cold, and we'll use the pillows after. So I'm just gonna wash my hands.
Okay. I'm just gonna use the
Okay, so before we get you into position, I was wondering if you wanted to see the equipment that I'll be using today.
No, not too much. If you can just walk me through as you're doing.
So there's just one thing. There could be an option for you to actually hold the speculum in your hands, because I know you said you were cold. Sometimes the metal speculum can feel cold. So
sure.
would you like to warm it up in
sure.
your hands before we go? Okay. So I'll hand it to you once you're in position, and then that way you can move freely.
Awesome.
Okay, so for the positioning, what we'll want to do is have you sit with your bottom very close to the edge of the table here.
Okay.
You will have the option to either lay back or to be in a semi-sitting position. Do you think you have a preference for either?
I think I want to sit.
Perfect.
Actually.
And then there'll be two options for your feet. I can pull out footrests for you to rest your heels in, or we can rest your legs on a shelf. Do you have a preference for either?
Let's try the footrests.
Okay,
first.
so I'll set them up first so that your feet have somewhere to go when you come to the edge of the table. And then I will get to the back of the examination table. So you can scooch your bum to the bottom. Okay. Okay, I'm going to place the pillows. You let me know if that's comfortable for you. Is that okay?
Yeah, the back is fine. The feet are a little...
Not ideal.
Like
Let's try the shelf instead, okay? Are you able to raise them just for a second? Yeah. There we go. So you can rest your heels together and let your knees fall open like little butterfly wings. So how does that feel? Are we okay like this for a little bit?
Yep.
Okay, so let me pull out the speculum. I'll just hand it to you so you can warm your speculum.
So just over here?
Yep, exactly.
Awesome.
Okay, so another thing that I wanted to give you an option for is that after you're done warming your speculum, I could actually hand you a mirror. So if you wanted to observe the examination as I do it, you would have that option as well. Do you think you'd like to watch?
No, thank you.
Perfect. So I'll just leave it here, so if you change your mind, you let me know.
Okay, perfect.
All right, so I'm all set. I'm ready to go. So when you are...
I think this is warm enough.
Perfect.
Also.
Let's put it away. Excellent. Okay, so when you're ready, you'll be able to just hike up your blanket a little bit.
First, I am examining the outside of your genitals by visually inspecting the skin for any abnormalities. I see no discoloration, no rash or lesion, no abnormal hair distribution, and no evidence of trauma. I am noting the absence of abnormal discharge, odor, or prolapsed organ. Everything looks healthy. Then I will use my fingers to palpate your groin creases for any tenderness or for the presence of masses. Do I have your consent to continue to do so?
Yes, you do.
Okay, you will feel my fingers on your left side, starting close to your pubic bone and moving down along your groin crease, palpating as I go. Any pain or tenderness anywhere?
No.
Okay, I'm going to do the same thing on your other side. Any pain or tenderness?
No.
I did not note any masses or tenderness. This part of the examination is also normal. I will now examine your vulva. You will feel my fingers on each side as I separate your labia to assess for any abnormalities. Can I continue?
Yes.
Okay, you will feel my fingers on your left side and then moving to the right. And lastly, at the top of your pubic bone so that I can properly visualize inside the labia minora. I can visualize the clitoris, the urethra, and the vaginal opening. The skin color is normal. I did not note any rashes or lesions, any inflammation or any scarring. The perineum is smooth and the anus appears normal. Can you cough for me, please? This will allow me to assess for any prolapsed organ. No prolapse noted. Now I'm ready to move on to the bimanual examination. This involves placing one of the hands on the lower abdomen and inserting two gloved and lubricated fingers inside the vagina. This allows me to palpate your cervix, your uterus, and your ovaries. I will be assessing for any tenderness, masses, and I want to get a sense of the size and position of your uterus. Do I have your consent to continue?
Yes.
I am going to stand up and move to the side of the examination table. You will feel my hand on your lower abdomen, just above your pubic bone. Is there any tenderness when I press down like this?
No.
Now I'm going to prepare you for the internal examination. Okay, I'm ready to proceed with the internal examination. Do I have your consent before I continue?
Yes.
You will feel my lubricated fingers at the entrance of your vagina. When you're ready, I will insert them one at a time, slowly. It may feel cold because of the lubricating jelly, but it should not be painful. If there's any discomfort or tenderness, please be sure to let me know. Remember, you have the right to refuse at any point during the examination today. I'm using the fingers on my left hand to separate your labia carefully before I place my fingers from my right hand inside your vagina. I'm inserting the first finger and pulling gently towards your buttocks to make space for the second finger. Now I'm inserting the second. Any discomfort?
No.
Can you try that pelvic floor contraction? Try to squeeze gently around my fingers. I can feel a muscle band on the left and the right side. Your muscle activity closed my fingers together. This is a normal finding. I'm examining the walls of your vagina. You will feel me rotating my fingers so that I can examine the walls on all sides. I'm also reaching up to the superior portion of the vagina, called the fornix, on each side. I am palpating to assess for the presence of any masses or irregularities. I am not finding any. Is there any tenderness here?
No.
Now I'm palpating at the surface of your cervix to assess its position and consistency. Your cervix is midline, posterior, smooth and firm, with a closed cervical os. These are all normal findings. I am now pressing on your lower abdomen with my other hand, and I am moving your cervix slightly from side to side with my fingers. This may be uncomfortable, but it should not be painful. Now I'm going to assess your uterus. My hand on your lower abdomen is palpating for your fundus. By applying gentle pressure with my hands, I am assessing the size and position of your uterus. It is not enlarged. It is tucked away behind your pubic bone. You have an anteverted uterus, which means it's just slightly tilted forward at the cervix. This is a normal finding. I am now assessing the uterine walls by placing my fingers at the fornix on each side. Your uterus is firm, smooth, and the fundus is rounded. It is freely movable. Do you have any tenderness when I do this?
No.
Next, I will assess the adnexa on each side. That just means I am checking the area that includes your ovaries, fallopian tubes, and the ligaments that hold your uterus in place. Are you okay?
Yes.
Can I continue?
Yep.
You will feel my fingers moving towards your left side, and the other hand on your lower abdomen is also moving to the same side. I am applying pressure from both hands to try to palpate your ovary. I cannot feel it, but that is also normal. The structures are movable and not enlarged. I am not feeling any other masses or lumps. Is this causing you any discomfort?
No.
Okay, I am moving both hands to your right side now and repeating the exact same assessment. Any tenderness on this side?
No.
That is the end of the bimanual examination. I'm going to remove my fingers now. You will feel me putting some counter pressure on your vulva to prevent any discomfort. I am not seeing any blood or abnormal discharge on my gloves. All findings so far were normal. Let me just wash my hands and put on clean gloves. For the next part of the examination, I will go back to sitting on my stool at the end of the examination table and ensure the light is still positioned properly. Then I will insert the lubricated speculum, which is a small plastic or metal tube, to be able to visually examine the inside of your vagina and your cervix. Here are some things to consider when using a speculum. Now that you have performed your bimanual exam, you can ensure that you have selected an appropriately sized speculum for your client. Ensure that you know how to open and close the bills of the speculum. Ensure that you know how to lock and unlock the bills of the speculum using the notched locking tab or the thumb screw. Using a metal speculum, think ahead. It may need to be warmed. You can run it under warm water. You can hold it in your hand. You can ask the client if they want to warm it up themselves in their hands. If using a plastic speculum with an integrated light, ensure the light is functional prior to use, and remember to keep the light attachment prior to disposal. If there is no integrated light on the speculum, ensure that you have a proper lighting setup. Now we will proceed with your PAP and STBBI testing. Do I have your consent to continue?
Yes.
Okay, you will feel the lubricated speculum at the entrance of your vagina.
Okay.
When you're ready, I will insert it slowly. It may feel cold because of the lubricating jelly, but it should not be painful. If there's any pain or tenderness, be sure to let me know.
Okay.
Remember, you have the right to refuse at any point.
I'll let you know.
I'm using the fingers of my hand to separate the labia carefully before I insert the speculum inside your vagina. I'm inserting the speculum on its side with the bills closed while applying slight downward pressure. If you are feeling tense, you can bear down while I do this. It will help you relax, and it will relax your perineal muscles. Now that I have inserted the speculum almost all the way, I am rotating it into position. Any discomfort?
No.
Okay, I am going to continue to insert with a downward angle towards your lower back to match the slope of your vagina. Now that it is in place, I am gently opening the bills of the speculum to get a clear view of your cervix. You may feel a bit of pressure. I'm using the locking mechanism to keep them opened. Are you still doing okay?
Yes.
I'm examining the walls of your vagina. I see no discoloration, no mass, no lesions, ulcerations, or atrophy. There's no evidence of a foreign body or any trauma. I am noting no abnormal discharge and no odor. Everything looks healthy. Now I am examining the cervix. I am validating that your cervix is midline, posterior with a smooth surface. It is pink and even. It's about 2.5 centimeters in diameter. I'm noting the absence of any erosions, masses, ulcerations, or scarring, which are normal findings. Your cervical os is small, round, and closed, consistent with you never having children. Do you have any questions before we move on to the PAP and the STBBI testing?
No.
We will start with your PAP test. First, I will use a large cotton swab to remove any excess discharge. Next, I will take a cervical spatula and rotate it in a clockwise manner, being sure to scrape any cells from your cervical os. I will make sure I do one full rotation, remove it, and spread it on the cytology slide, making sure to remove any cells from both sides of the cervical spatula. Next, I will take the cervical brush and insert it into the opening of the cervical os, rotate in a clockwise manner to ensure 2 full rotations, remove it, and then brush it along the cytology slide, being sure to rotate fully along the slide. Next, I will take my labeled cytology slide and spray it with fixative spray before sending the slide to the lab. An alternative method to PAP testing is HPV testing, using a cytology broom and thin prep liquid-based cytology. Using the broom, you insert into the cervical os and make sure you take 2 full rotations using the cytology broom. Remove it, and then place your thumb close to the cytology broom head and drop it into the liquid-based cytology. Make sure that you label your cytology liquid, close the cap firmly, and then send it to the lab. Next, if required, I will take a cervical swab for culture. Here, I am taking an endocervical swab by placing the culture swab into the cervical os. Remove it. Make sure it is tightly sealed and labeled, and send it to the lab. When performing STBBI testing, it may be necessary to take an endocervical gnat swab. I am placing the gnat into the cervical os, rotating the swab, and removing it. I then snap the swab, put the lid on, make sure it is appropriately labeled, and also send it to the lab. The examination is complete. I'm ready to remove the speculum. I am withdrawing it a few centimeters to release your cervix, and then I am unfixing the bills. I am closing the bills gently, but please let me know if you feel any pinching. You will feel me rotating the speculum to the side and then removing it completely while I provide some counter pressure on your vulva.
Okay.
All right, so you can close up your legs now, and you might experience some light vaginal bleeding after today's examination. That would be normal. So you may feel more comfortable wearing a panty liner for the rest of the day. But if ever you have any concerns, don't hesitate to reach out.
Okay.
Okay? So do you have any questions for me?
No.
No? Perfect. So what I'll do is I'll step out and leave you to get dressed. Here are some wipes if you want to wipe away the excess lubricant. And just join me on the other side of the curtain when you're ready.
Okay.
Perfect.
Thank you so
Thank
much.
you.